When you're looking for the esophagus in netters, you're actually going to find it in the thorax because the majority of the esophagus, which is right here, this structure here, is found within the thorax of the body and not within the abdominal cavity. However, it does join up with the stomach within the abdominal cavity. So the esophagus runs anterior to the aorta. Generally, in most of the images, you'll find it anterior to the aorta, but it may also be to the right of the aorta. As you can see in this upper part of the thorax, the aorta is here, this structure here, and the esophagus is just to the right of it and probably slightly anterior, just depending on the patient and how the structures are laid out in their body. It enters the abdominal cavity at about T10. So when you're looking at the structures that enter into the abdominal cavity, the IVC is first, and it is at T8, and it enters through the caval hiatus, if you remember, or cable or caval, I think both are correct. Hiatus, and then the esophagus enters at the esophageal hiatus at T10. So, T8, and then T10 for the esophagus, and then T12 for the aorta. And you can see the diaphragm is here, and that is the border of the abdominal cavity, and the cruise of the diaphragm is here on either side of the aorta, and that's what we see when we see it in the axial slices in the CT scan. And the esophagus joins with the stomach at the cardiac orifice, and we'll look at that a little bit more carefully when we look at the next slide. And if you look over here at the side, you've got the diaphragm here on either side of the esophagus, and then the esophageal sphincter that controls the passage of food from the esophagus to the stomach. And when you're looking at the juncture for the esophagus and the stomach, you might actually see the fundus of the stomach and the esophagus separately on a CT image before you get past this notch here where the two of them connect, and then you'll see the esophagus and the body of the stomach in one image. But you usually see the fundus separately from the esophagus until you get past this point here. This picture of netters, you'll see that they have lifted up the liver. So this is a gallbladder that would normally be hanging down and anteriorly, but they've lifted it up so that you can see behind it. This is the fundus of the stomach. In an upright patient, you would expect to see air fluid levels here. And then you have the body of the stomach here, and the pylorus, and the pylorus becomes the duodenum. And because the patients are normally laying supine or on their back, and their stomach is the most anterior part of the body, as you look over here, you see this is anterior, the patient's laying on their back, and this is the stomach coming across. The air fluid levels then move to the front portion of the stomach here. So you'll see the air fluid levels and the most superior portion of the body at that point in time, which is the anterior side. You'll also see air fluid levels in the large intestine, so this is the splenic flexure here. And then we will go on to study the duodenum in the next slide. One thing to note here is the pancreas is lying posterior to the body of the stomach, and you can't see that here. You've got the spleen off on the left side of the body, so spleen here. The body of the pancreas is going to be lying posterior to the body of the stomach, and the stomach moves from superior to inferior. It also moves from left to right as you go down through the stomach and from the esophagus to the duodenum. You're moving from superior to inferior, from left to right. You're also moving from posterior, to anterior. So you're moving posterior to anterior. And in the next slide, you're going to see that really well because I have some sagittal pictures that will show you how the stomach moves from superior to inferior, and also from posterior to anterior in the sagittal view. Take a look at these sagittal images. We have Netter's 5th edition, plate 323 here on the right, and then I have taken a screenshot of an image that I set up for you in Netters 3D. That's another nice tool to use. I know I've told you about BioDigital in the past, but Netters 3D is also a nice tool to use. I'm looking at trying to get you access through the Bellevue College Library, but we're not sure whether we're going to be able to support that or not. But I have some librarians researching it for us now. This is the anterior side of the patient here and here as well, and then the posterior side of the patient with the spine running down. In this image, they've taken a sectional slice, a sagittal slice, pretty much midline, because you can see the spinal column running down here. This is the liver, this is the stomach, and you've got the pancreas here and here. So you see the pancreas lies posterior to the body of the stomach, and the body of the stomach is just inferior to the liver as well. You have the splenic vein and the left renal vein coming out here, the celiac truncal axis, and the SMA, just for a quick review. And then these are loops of bowel. This is a transverse colon here, and then these are loops of small bowel here. And this is the first part of the duodenum. Excuse me, the third part of the duodenum. And if you look over at this image here, it's a little bit easier to tell that the stomach runs from posterior to anterior. So as it moves left to right, it moves posterior to anterior. It also moves superior to inferior. So it courses in all three directions, basically left to right, posterior to anterior, and then superior to inferior. And it courses just underneath the liver there. There are many different positions for the stomach, just depending on the body habitus, whether you're a taller, thinner person, or maybe a little bit more broad in the waist and the chest. Your stomach will have various positions. So when you're looking at a CT, it's helpful to know that there are various positions of the stomach, because you may not always see things in the exact same place on every patient. We've looked at the duodenum a lot when looking at the pancreas and the spleen, and there are other good images in Netters that show you this image, but this one gives a little bit more detail. This is Netters 5th edition, plate 270, and it gives you more information about the duodenum and the different portions of it. So once again, the pancreas sits within the C-loop of the duodenum, and the duodenum basically cradles the head of the pancreas. It's about 25 centimeters in length and is C-shaped. And the different portions of that C-shape are the superior portion, the first part. It begins at the pylorus, so the stomach would be attached here, and the pylorus would come down and attach to that first part of the duodenum, and extends all the way over to the gallbladder, and the gallbladder has been removed here, so we don't see that. It's horizontal, so it goes straight across here in the body, within reason. That's the most general position of it, is horizontal. The IVC, the portal vein, and the common bile duct all course posterior to this portion, so they're all behind the C-loop here that you don't see. You can just see the images here of where those pieces have been cut away. Those all sit posterior to this first portion, or the superior portion of the duodenum. It lies along the superior portion of the pancreas. And then the descending portion makes a sharp turn here and descends. And that portion is where the pancreas and the ducts of Wirsung and Santorini come into the duodenum through the ampulla of Vater and the duodenal papilla. The third portion is again another horizontal portion, and it's inferior to the head of the pancreas. It courses right to left, and also is anterior to the aorta and posterior to the SMA and SMV. And that's why I wanted to show you this image versus some of the other ones that don't show this in such detail. But you can see this third portion of the duodenum here, and then that SMA and SMV anterior to it, and the IVC and the aorta posterior to it. And then after that, you have the ascending and fourth portion of the duodenum. It is slightly to the left of the aorta, and it lies along the inferior portion of the pancreas here. So you've got the inferior portion of the pancreas, and you've got the fourth or ascending portion of the duodenum. And here, in this image here, you can see the SMA and the SMB. You can see the head of the pancreas, and you can see the second portion of the duodenum, or this descending portion over here, wrapping around the head of the pancreas. The IVC is posterior, the aorta is posterior, and the duodenum would wrap around here in between the SMA, the SMB, and the aorta. From that fourth portion of the duodenum, then we have the jejunum, and the jejunum is this tightly coiled and mostly in the umbilical region of the abdomen, and it winds around for a very, very long time. And when you look at this on CT, it can sometimes, with the contrast filling it, it can sometimes look like little puffs of clouds, or Maria always said that it looked like little bits of marshmallows, and you'll see that on the CT scans. And then it attaches to the ileum, and the ileum is located in the hypogastric region, which is meaning hypo meaning below, and gastric meaning stomach, so below the stomach. And in this image here, you can see that the transverse colon has been lifted up a bit so that you can see the whole area of the jejunum and the ileum, but it normally lies down here and goes across the anterior portion of the abdominal wall here. This image in Netter shows you a really good view of the ileocecal region, so the ileum here coming into the cecum, and the cecum is this beginning pouch here before it goes into the ascending colon, and the appendix comes off of the inferior portion of the cecum, and remember that can get inflamed or become infected, and a lot of times if you get an abscess here, you'll have ring enhancement with the IV contrast, but the inside portion of it won't show as enhancement because it's either pus filled or fluid filled, and that normally does not enhance. So this is the cecum here before it goes into the ascending colon. This image in Netter's is similar to the one where I was showing you the small intestine, and once again the transverse colon has been lifted up slightly. Normally it would hang down here across the front of the abdomen, but they've lifted it away so you can see the entire colon in one picture. The entire colon is about 1.5 meters, and it begins right after this ileocecal junction here. So this is the ileum coming into the cecum. Again, the appendix here, which can be in various places along the cecum. And then you go into the ascending colon, which runs along the anterior abdominal wall, comes up out of the right iliac region along the anterior abdominal wall. It makes a sharp turn at the hepatic flexure. The hepatic meaning liver, so hepatic flexure is near the liver. The transverse colon runs from hepatic flexure all the way across to the splenic flexure. And again, it makes a sharp curve, and it comes down to the descending colon, and that runs along the anterior abdominal wall again, but this time in the left side of the body. And then it curves into the sigmoid colon, and that can be various pathways. It can be really tortuous, or it can be a little bit more of a straight line. And the sigmoid colon then will take you into the rectum and down into the anal canal. In the CT image here on your left, you have the spine in the posterior portion of the body. This is the right side, and this is a little bit of the liver. We're down pretty far inferior in the abdominal cavity now. So we're almost out of the liver, and this is the left side of the patient. You've got the vertebral body here, the aorta just anterior to that, the IVC to the right of the aorta, and this here is just the third portion of the duodenum as it goes horizontally. You'll remember that the third portion of the duodenum courses in between the aorta and the SMV and the SMA. So this is SMA, superior mesenteric artery, SMV, superior mesenteric vein. Just posterior to that is the third portion of the duodenum, and posterior to that is the aorta and the IVC. You'll see this little contrast-filled area here is a small intestine, and you can see how it kind of looks like puffy clouds or marshmallows, whatever you choose to remember it with. And then you've got the hepatic flexure here. Remember, the larger intestine tends to have air fluid levels where the smaller intestine generally doesn't, at least on CT. You've got the hepatic flexure here, so over on the visceral side of the liver, just inferior to the liver, and then the transverse colon coursing across the anterior portion of the abdominal cavity, and then you've got descending colon over here. You can see in this picture the sigmoid colon coming down, and it does a little bit of a sharp curve here, and there are several pathways within the pelvis of the sigmoid colon, just depending on the patient, and there are various positions. In Netter's plate 276C, you will see the various positions, but I just chose one of those images to place here so that you could see that most of that sigmoid colon is contained within the pelvis. And after the sigmoid colon then becomes the rectum. It's about 12 centimeters in length, and it's from about the third segment of the sacrum to the tip of the coccyx. So it really courses through most of the sacrum and coccyx here. So it will be just anterior to the sacrum and coccyx on a CT or MR image. And then the anal canal is at the very end of the whole alimentary canal. It is 2.5 to 4 centimeters in length and is supported by the levator and ani muscles, which we will see when we study the muscles of the abdomen and pelvis.